Just a moment, I'm pulling it up.
Hi, Jim. Thanks for making it.
There you go.
Can everyone see it, the statement? Okay, and everyone feels okay about the recording, correct?
Yes.
Yes.
Great.
You know, I kind of read that you are approaching an event area, and I kind of hear the robot from Lost in Space saying, "Warning, warning, warning." Does anybody remember the robot from?
Morning, Robinson.
Yeah, I was a Twilight Zone person, not a
Oh, I love
Lost in
Twilight
Space
Zone.
person.
Yeah.
Some people would argue I'm still lost in space, though.
I think Outer Limits was the top for me, though. That was just so bizarre. Lots of great monsters.
Okay, so I think we should, is it time? I think we should begin.
Okay. You know, wait 2 minutes until 5 after?
Okay, we'll wait 2 minutes.
Okay, thanks.
We want to let people know that we do have a poll going on right now. And we'd like to ask you a little bit about how you came to us today. So if you'd be willing to tell us a little bit about yourself, there's a few choices. We would really appreciate that. If you could take your time and answer that, we appreciate it.
Yes, you know, it helps us know who we're serving and helps us, you know, organize events in a better fashion in the future. So that would be great, all of you. Thank you. Hi, Christina.
Okay, so once again, we're waiting just another minute or so. If you just came in, I want to let you know that this session is being recorded. And if you would be kind enough to answer the question in the poll about a little bit about yourself, your background, we would appreciate it. We got a comment about the poll. Okay, I just want to say that's an excellent idea, Christy, so thank you. Okay, so we're just waiting on a handful of people to respond to the poll. Please read all of the possible choices. I know there are going to be people who are going to say other, but if you could try to fit yourself into one of those categories, we would appreciate it.
Could you please mute yourself when you're not speaking so we don't have background noise? Thanks.
Hear that noise?
Give me a second. It's me, Renee.
Oh, okay.
Okay, thank you.
I cannot get my.
We weren't going to out you, by the way, just to let you know.
Okay.
Thank you so much for all your responses.
Yeah, there's quite a few.
We're up to 31 attendees.
If you are coming in right now, we want to let you know that you are welcomed. You're also being recorded, so we want to let you know that. We have a poll going on in which we're asking people to tell us a little bit about yourself. If you could do that for us, we would truly appreciate it.
Can you resend me the poll, you guys? Because it just disappeared on me.
Okay. Sylvia, can you do that?
Oh, hi, Renee.
I don't know how to do that.
Ellen, are you seeing in
The-
the chat that we can only answer one in the poll? The computer's not letting us answer multiple choices.
Yeah, I think it was set up that you can only answer one.
Okay, so just in case you don't know.
And I agree, Joe, there's a lot of people wearing many different hats here, but we're asking you to select the one that is the closest to one of these responses. Okay.
Can I ask a question?
Please.
My name is May.
Hi, May.
Hi, everybody. One of the one of the friend, he need the link so he be able to join. His name is Craig. Is there a way to send him the email?
I think that's a Sylvia question or a Yolanda question.
I can try to help with that. I'll just have to stop the poll and stop sharing my screen.
Okay.
Are you okay with that, Ellen?
Yeah, I think for just a couple of minutes. First of all, let me ask, did everyone have a chance who wanted to respond to the poll question?
I didn't get the I mean, I tried to participate, so I pressed the skip poll. So I didn't look at what is the question. So is there a way to put it in the check box? So be able to answer that question?
Is there a way we can put it in the chat, Sylvia?
Unfortunately, I don't know how to bring the poll back after, someone selects to decline.
Okay.
But we have a demographic survey that folks can fill out and we can get, more information there.
You can also comment on the evaluation at the end, can't you, Sylvia?
Yes, that's right.
It's a good point, all of you. Okay. Let's see if we can help your friend May. And I just want to welcome people again. I guess that means that I'm going to have to read the community agreements instead of showing people the agreements on the slide. Is that going to be okay?
Well, Ellen, actually, I think I can still share my screen. I'll multitask with my phone.
Okay, great.
Is it okay to end the poll?
I think it's okay to end the poll.
I can share results really briefly. Do you want to do that?
That would be great. Let's do that. Okay. So we have a lot of family members here today. People who use mental health services came out ahead, but we still have people who provide the services, who work in educational settings, affiliated with religious or nonprofit organizations, and people who are advocates and support consumers. That's fantastic. I think it's wonderful that we have this diversity here. Would the panelists like to say anything about the poll?
I'm grateful for all the consumers that are here and the support of the providers. Thank you.
I think it's great that it's evened out quite a.
Yeah, Okay, well, great. Thank you. We want to start with some community agreements, if that's okay. And I'm hoping we can get that up there.
Yeah, I apologize if the screen is partially blocked. I'm gonna try to fix
And I
that.
apologize, my cat is crying. Please know, everyone out there, that I am not torturing her.
At least your cat is awake. Mine are unreliable like that.
Ellen, did you want me to briefly mention this?
Yes, yeah, that would be great. Sylvia, thank you.
Okay, great. I apologize. I'm trying to figure out why the screen's partially blocked, but I'll put it in the chat as well. But if you can see at least some of the screen, this is a demographic survey. So I'll put the link in the chat, and this, as John mentioned, helps us understand who we're reaching. And in that, in the questions, you'll be able to choose multiple different hats that you wear, different roles that you have. And so again, we're recording this event. And do you want to mention this, or do you want me to do this, Ellen?
Oh, okay, yeah, I can do this. I forgot there's housekeeping in front, before the community agreements. We're asking people to use chat for your questions and comments. The panelists are going to go through some questions, and then at the end, they are going to take all of your questions, and we want you to participate. That's very important for all of us. There will be specific times held for those joining by phone to make comments. And please understand, the world we live in does not make Wi-Fi stable and steady at all times, and there may be unexpected technical difficulties, and please just bear with us.
Thank you, Ellen.
You're welcome. And these are the community agreements. I don't know what that yellow box is in the middle. But we have just a few that we would like to share with you today. The first is, we're assuming everyone is here today and bringing lots of good intentions with them. Please take space and make space. And that means let all who want to participate, participate. Practice active listening. And that means listening to understand the speaker before making yourself understood. Make space for people to learn and grow. Recognize that people are at different levels, and refrain from judgment on their lack of knowledge. There's a lot of wisdom in this room, but everybody is on their individual path. So we have to accept people for where they're at. Do your best to be courteous and respectful. I don't even think I have to say that. I think everyone here will do that. Let us keep the space safe for all of us. And I think that's really, safety is really important. Own your impact. That means please be aware of what you're saying and the what that will mean, how other people will hear it, interpret it, and what that will mean to the people who are listening. Uphold what is confidential. Please let it stay in this place and keep it here. And finally, we have zero tolerance for hate, prejudice, or discrimination. Are there any questions about the community agreements? Anyone? Okay, so we're moving on. I am going to introduce our panelists, but before that, I just want to say a few things. We're going to be keeping this definition of recovery up when we get to the recovery section. The first part is the growth. And so I want to share with all of you that this month, which is Mental Health Awareness Month and AAPI Month and many other things, is also Older Americans Month. And every day, approximately 10,000 people turn 65 years of age. And based on this, demographers have projected that by the year 2029, 1 in every 5 people in the United States will be 65 years of age or older. So we know that the importance of keeping older people engaged, productive, which can be defined in many ways. And we want older people to contribute to the quality of our community lives and to the quality of their own lives. But there are a lot of myths, and I'm going to explain just a few. There were probably, at least 20 we could have chosen, but we chose only a handful. There's the fallacy of judging others. And we judge people, particularly older adults, by their state of mind. And it's often based on our own experiences and our own state of mind. It's also based on the messaging that we get in society, which is very widespread, and it's a lot of misconceptions about aging, and also a lot of misconceptions about mental health. There's also, as we age, there's an assumption that we are less capable and we are more susceptible to things like scamming. We need more support to help us make decisions, and we are more set in our ways. One of the myths is that older people cannot make good decisions about important issues. I just want to say, in my 30 years working as a gerontologist, that I have found that age brings lots of wisdom, and cognitive skills are based on a lifetime of experience and education. And the science has pretty much looked at a lot of the questions about aging. A lot of great things happen when we get older. And I know that's not the message that we get in society. I want to remind people that Johannes Brahms did not write his first symphony until he was at least 60 years of age. And so there is a lot of creativity and interest in spirituality that happens as we get older. There's also higher levels of mental resiliency because we're able to rebound from a lot of the challenges and adversities that we have faced. And we're able to demonstrate over and over again how we can recover from those challenges. I was mentioning to the panel earlier that I learned when I went to Outward Bound School that the reason Outward Bound School, which by the way is a survival program for those of you who don't know it, but the reason it was created is because when sailors would get into situations like they had to jump ship, the older sailors tended to survive and the younger sailors didn't make it. And people wanted to know why. And it had a lot to do with the resiliency and the experience of older people. And that's why intergenerational programs are so vital for our communities. I think I just want to add just a little bit more, and that is there is a little loss of function with older adults. But what we have found out even though it may take us longer, in terms of intelligent tests, we do as well, if not better than younger people. Just takes us longer to answer. And that makes sense because we have more knowledge to sift through in order to find the right answers. So we're here today. We want to talk about the challenges and the recovery about mental health and how we're able, through our lived experience, to be able to handle these challenges and to use a recovery model to help us. I'm going to introduce the panel. We have Jean Perry, who lives in Millbrae. Hi, Jean. And she's a graduate of the Lived Experience Academy. And she's had experience dealing with family members who had mental health challenges. She herself was a nurse practitioner and worked in medical research. She served vulnerable women in that role. She volunteers as an organist, which I didn't even know until this week, with the Church of Jesus Christ of Latter-day Saints. She leads a NAMI family-to-family education group, and she currently serves on the commission as the commissioner on the MHSARC and the co-chair of MHSA Steering Committee. Welcome, Jean. We have John Butler. Where is John? Hi there. John is also a Lived Experience Academy graduate. John lives in Menlo Park. He's the recipient of the 2020 George Coulouris Consumer Hall of Fame Award. It's quite prestigious. John is a fan of cats, comic books, and Pete's coffee, which means he likes his coffee very strong. And finally, there's Calvin Shelton. Welcome. And Calvin had something to look forward to while he was in high school. Unfortunately, the Vietnam War was going on then. Calvin was able to acquire a merchant marine document for the United States Coast Guard, and he was able to ship out for many years as a civilian crew member with the military Sea Transport Service. Many years later, Calvin experienced a serious emotional breakdown, and that was the beginning of another journey. And with the help of BHRS, which is San Mateo County Behavioral System, he was able to embrace the recovery model, and he was able to journey into the broader community. He worked for many years with the rehabilitation agency named Caminar, and I believe they are in San Mateo. And at present, he is a part-time worker with NAMI. He does talks in their outreach program. He's also the chair of on the Heart and Soul Board, who offers stigma-free environment so people can grow. And also they have drop-in centers in San Mateo County. He does all kinds of talks, including seeing through stigma. And beside all that, he's an advocate and a volunteer with BHRS. Wow, do we have amazing panel. I'm so honored to be part of this today with you. Okay, so I want to make sure the panelists can hear me and can see me. And we will start with some of the questions. So I have many questions and we're going to get more in the chat, but here's the first one for you. Would you share something about your experiences that dispels some of the myths about mental health and dispel some of the myths about mental health and aging. Who wants to go first? I think Jean wants to go first.
Jean wants to go first, that's for sure.
Thank you, Jean, for volunteering.
Our Commissioner Jean Perry from the Mental Health, Substance Abuse and Recovery Commission, along with Patricia Way.
So if that qualified me with more wisdom than the attendees, that would be awesome. But I am in awe of the of we have here today, and certainly I don't have the corner on the market. I would say I've got to admit that when I am in the scripted part of the family training, when I am say that Medicare is the insurance plan for the elderly, that I almost gag. Because although I am a Medicare recipient and by age, I feel far from elderly. So I think I probably carry some of that stigma about being considered old. So one of the things that one of the myths that I would like to address briefly is that older people don't have the capacity to heal and grow, recover, whether that is the mental health and substance use arena in terms of physical incapacities, because it is a myth. Even 90-year-olds can increase both their cognitive and their physical abilities by simple exercise that are conducted in a chair. So,
excuse me, Jean, I hate to interrupt you. You're in a great thought, but we're hearing an echo and we're wondering if you have two devices on at the same time. So would it, you don't. So would it be possible for you to get maybe closer to your mic? Yeah, I'm sorry to make you do that. And I apologize to our audience.
Yeah, I'm hearing that also, so I'm not sure what that's about.
Okay.
And so I would say that that there's science behind that neuroplasticity is not just something that newborns have. We have the ability to make behavioral changes that result in improvement in our mood. We have the ability to make behavioral changes that help us move along in our recovery. And so I hope I adequately bashed that myth.
I think you did a great job, and I apologize. I had to interrupt in the middle of it. But that was brilliant. Thank you. Okay. Who would like to take the question? Calvin or John?
I can go next.
Okay, John, thank you.
Actually, I think Jean described a really important part of elderly, older adults. I shouldn't say elderly, mental health matters. I'd like to make a general comparison, though. I'm a colon cancer survivor, and I view mental health as a lot of people see mental illness as some kind of strange derangement, and that we're broken beyond repair, and the words crazy and things like that we've heard historically. But I view mental health as a form of mental cancer, and I am a survivor of that as well. And it is a disease just like any other physical disease. Some people believe it's brain chemistry. Today, there's evidence that it may be your gut health that's affecting your mental health. So I take a probiotic, a Metamucil, and a laxative for my colon cancer. So I'm treating my stomach well to keep that gut health in control. And that's one of the myths that I feel stand out the most to me is that the way people in general feel about mental health. And, you know, we're just normal in different ways. You know, normal is really just not one basic definition. Uh, what is it? Differently abled, they say. You know, uh, but that's my main thought about that.
Sorry, I muted myself, and I just want to say thank you for dispelling that myth. I think it's really important. And I think we do know from what we have read of the studies that unfortunately people with mental health challenges are often marginalized in our society. And we really need to work to make sure that that does not continue. Thanks, John. Calvin, I'm going
Okay,
to you now. I hope you're ready
okay.
for the question.
Yeah, thank you. Yeah, the myth that uh, you're not wanted, you're going to be phased out. Thank God that I live in San Mateo County. I'm very much involved. With my wisdom and knowledge, I've been able to speak in front of communities with Heart and Soul, STS, See It Through Stigma, and also in our own voice with NAMI. I am also a graduate of the Lived Academy. So this gives me an opportunity to share my wisdom with other people and let them know that recovery is possible. So you've got to have a memory for that. So that's another myth. We do have good memories. And I think that I have never felt old. I don't know why.
Yeah,
You
not
mentioned
needing, like we don't need any of it. Like we can show the art on the floor, but like
the Merch Marine. Yes, when I was wiped out psychologically, physically, and emotionally, I did have a reference point, and that was my work and experience with the Merchant Marine shipping out. So I always had that reference because, like I say, my self was broken and a new self had to be built up. But again, I want to say that I think about 7 years ago, I had a double bypass and I've never felt better. A lot of it has to do with attitude. A lot of it has to do having faith in your treatment team. But I want to say this, if it wasn't for my proactive in seeing the primary doctor, I would have never found out about the echocardiogram. That's where the red flag came in. So think positive, and be proactive, and you'll make it. Thank you.
Ellen, can I make a follow up to that?
Yes.
Please, please, John.
I just want to mention someone who's here with us today, Brenda Nunez, is the co-chair of the Diversity and Equity Council. Hi, Brenda. So I just want to mention that I always do, that if you are in need, the mental health community in San Mateo is inclusive as hell. I mean, it's like supportive. The providers I found are just excellent in helping us. And it's to me, my mental health community is, I think, more of a spiritual experience than my church experience because of the love and the genuine, the authentic nature. We share our pains and our joys together. And I just want to welcome you if you're in need to seek us out. And Brenda is one source of that. Brenda, if you want to put DEC in the chat, maybe. Thank you. Okay.
Yeah, John, when we get to the question about your recovery process up until now and your younger self, I'll go into how it was with the medical model. and what was available to me at that time. I'm sorry, go on.
That'd be great. Go ahead.
Yes, and I also want to let people know that we will have resources at the end of this panel discussion for people who are looking for those resources. So thank you all for bringing that up. Question number 2. I think we're ready for number 2, and that is the growth process has its own challenges. There are successes and sometimes we hit some walls. What have you learned in your own growth journey that you're willing to share with our audience today? And John, I think I'll start first with you, please.
Sorry, I was responding to a chat. Can you repeat that? I was responding to a chat.
I'm sorry, you want it repeated to you?
Yeah, I was responding to a chat. So I wasn't.
Okay, no problem. The question is, the growth process has its own challenges. Yeah.
Mhm.
There are successes and sometimes we hit some walls.
Mhm.
What have you learned in your own growth journey that you would like to share with us today?
Oh, thanks very much. So part of my background is that I am a survivor of major depressive disorder for over 30 years. I am a suicide survivor multiple times in the past, and a recovering alcoholic of almost 18 years. And my friend James Eade is here with me. He's a good friend. Thank you, James. But growth process, I was pretty damn miserable for a long, long time. Substance abuse and alcoholism, suicidal ideation, even when I was not attempting for a long, long time. A lot of isolation. The ironic thing about COVID-19 is the isolation I experienced in mental health kind of helped me survive COVID-19. It's just like my depression made me tired of drinking, so I quit drinking. So it's kind of weird. But my process through recovery has been through all those things, and I discovered the help of peer support is what made a breakthrough for me in my life. A peer support, a peer who's a survivor of 21 years of substance abuse now, came into my life, and he spent 7 years with me, meeting with me almost monthly throughout that whole time. He's from South County Mental Health in Redwood City. That's the BHRS clinic. And the biggest thing that made me break through was that he listened. He listened with his whole heart. And he listened, and I was complaining. I tell you, we were in public in a Pete's Cafe, and I was swearing out loud at him. So, it was really out there. But he listened to me until I learned to listen to myself. And he told me continuously that, no, John, there's this and this and this about you're sensitive, you're genuine, things like this, that I could not see in myself. And he helped me see those things in myself. And I do see those things today, thanks to the support of our mental health community like Jean and Ellen and Calvin and Sylvia and so many others that are here. So my growth was just the support of peers. That's what made a difference for me. Thank you.
Thank you for that response. And as a person who works in senior peer counseling, I totally understand the value of having a good peer to listen to you. It really does make a difference. So thank you for sharing, John. Okay, Calvin, I'm going to ask you if you're willing to tell us what you've learned in your growth journey, please.
Yeah, I think the main thing is striving for empowerment. Now, you have to remember that when I broke down, I was completely wiped up, so I had no place to go but up. And that meant gaining some kind of empowerment. So in order to do that, you've got to go through trial and tribulation. And with that, you gain resiliency and you learn to bounce back. Now, what I mean is that I was homeless twice, and I'm very fortunate to have Section 8. If it wasn't for that, I'd be living with other people at this time with mental disabilities. And you cannot have growth if you are stressed out continuously. And that's what happens when you live with other people. So it's finally when Section 8 came in that I was able to live by myself and start to reflect and learn to live with myself. And I had comfort for the first time. And that's where really the empowerment came in. And also with that came family support and all the factors that come in the area of wellness. And also I want to say that there's a human condition where everybody, you don't have to be in the mental health system. We're all striving for empowerment, for comfort. It's the human condition. But I just want to say that the challenges, unfortunately, fortunately, I did work for Kamenar because I embraced the recovery model, and the recovery model said, well, there's such thing as peers, and peers are very important. So I worked for Kamenar as a peer support person. They were one of the first agencies in the county to hire peers. And, but unfortunately, I had a drinking problem at that time. I had a knee-jerk reaction. If I didn't feel good, I'd go to the bar. That's where I felt empowerment. That's where I felt strong. But that's only going to go over so far. So I was let go by Kamenar. We're still friends at this time. But what happened was I was in the corner. And because I was in the corner, I finally started seeing a therapist, another individual. And that made all the difference in the world. So with the homelessness, being homeless twice, had Section 8, no case manager with this homelessness, I had to do it. I had to get up every day. Thank God I know how to use a notebook because everything was written down, all those notes, where are you going to go, the phone numbers and so forth. But my sister took me in. She lives in Oakland. I made the trip back down here by BART and train, one small step at a time. So when you talk about challenges, you've got to do it, but there is support out there. And you slowly gain empowerment. And most importantly, you start liking yourself. And when you start liking yourself, that is when it's possible to have a good relationship. But it's not until you overcome and you start doing and liking yourself. Okay, thank you.
Just as a follow-up to that, Calvin mentioned Section 8, and I just want to say thanks to the Housing Authority of San Mateo. I have been on Section 8 since 2012. They've helped me stay in my home apartment in downtown Menlo Park, where I've been for, it'll be 33 years and December 1st that I've been in Menlo Park. And if it wasn't for Section 8, I could not survive. And having a home, seeing me through all my misery and suffering and depression and getting into recovery has been just the most precious thing for me.
Thank you. Thank you both for sharing that. A home of one's own. It's so important to feel that safety net, to have that place so we can come back to ourselves. I think it's really crucial. Thank you for sharing your journey with us, Calvin, and thank you for talking about the housing piece, John. Okay, Jean, I'm going to ask you the same question. What have you learned in your own growth journey? If you could unmute yourself.
There we go.
Thank you.
I'd like to talk about the walls that I've encountered. And I think part of the definition of becoming an older adult is you realize you don't know it all. That's definitely an advantage when you've kind of reached that threshold, and some people never arrive and some people very young arrive at that threshold. But one of the first things that I encountered in my younger life was that I was diagnosed with HIV. And I am a long-term survivor. I have been infected since 1979 and diagnosed in 1986. And there was no hope when I was diagnosed. There was no treatment. There was, you know, how soon am I going to die? And so that was quite a wall in terms of where do I go from here? And a really important aspect of the support that I got during that in-between time, when actually within a few years of my diagnosis, there were treatments that were effective, and it changed my life into basically a normal life. But what got me there was hope. And I remember when my care team, that's all they could offer me. Another situation that felt like just an insurmountable wall. There was nothing in my Rolodex to, what do you do when this happens, was when I lost my husband to suicide. And it's like, what on earth do you do with this? And I so appreciate the people in my life and the way that I was supported, not just in body and spirit and soul, but just as a whole person. So until you figure out what to do, hope is just incredibly important, so that you can put one foot in front of the other. And a third wall that I've encountered is our daughter was diagnosed with a serious mental illness within a year of my husband's death. And so she was young, she was 10 years old. And to have not had the opportunity to develop the problem-solving skills that youth do as they grow up before this illness hit her, it has felt like an insurmountable wall to try to get what she needs so that she can achieve recovery. So I think these impossible walls have promoted growth for me.
Our theme for Mental Health Month is Hope for Change.
I think all of you have had incredible journeys, and I see each and every one of you as a person of great strength. So thank you for your personal shares. In your journey, how did you find the support programs and services to help in your growth? And how were you able, I think this is the hard piece now, how were you able to accept those resources once you found out about them? Where were you at the point where you said, I really need to use these resources? And that's the question number 3 for this panel. And Calvin, I'm wondering if you could answer it first for us.
Well, yeah, I mentioned that I was in the corner because I got a DUI, was let go by Kavanaugh. We do have a good relationship at this time. When I was in the corner and something had to be done, I started seeing a therapist, and it made all the difference. But also, I think that you've got to be ready. That means you've got to do something about your symptoms. If you're full of anxiety, because when I broke down, the stigma was so terrible that, and at that time, the medication wasn't the best of the world until they came out with atypical. Because when I came into the system and started my recovery, it was the medical model. And, you know, I heard later on, I mean, you have to say, when I was young, I started my journey, there's no Google search, there were no cell phones. And I heard about the National Apartment Center in Massachusetts, And I finally had some role models, Dr. Daniel Fisher, Patricia Diggins, Judy Chamberlain, and I read all their literature. And I embraced this recovery model, and it got me to the end where I'm in an area of wellness right now. But what was so great about it was the holistic approach. So, but you've got to do your homework and find out that there is such a thing as the recovery model. Nothing happens in a vacuum. So I always say over and over again, take NAMI's peer-to-peer class, go to the drop-in centers that Heart and Soul has and the clubhouse. So, you know, things that when I came into the program many years ago, it's hard to believe what's going on in San Mateo at this time with all the initiatives that we have, the Pride, Latinos, Chinese, spirituality, African American. You know, I remember when Sally Zidman and Howie the Harp came from Berkeley, and they came to San Mateo County and said, "You guys need a drop-in center." So that was the start of the Peninsula Network, which came into Heart and Soul. It evolved into present-day Heart and Soul. But what I'm saying is, at one time there was absolutely nothing. I remember Arlene Aquino. I first met her because she's in the audience right now, and Heart and Kavanaugh at that time, I got into the supportive housing program. Later on, I worked for them. But one of the things about Kavanaugh at that time, you had to be out of the apartment at 10 o'clock. And what was available was the friendship centers. The Mental Health Association of San Mateo County had the friendship centers going. And so we've come a long ways. And again, I have to say that San Mateo is in the forefront. I do know that if my family had taken advantage of Heart and Soul, family to family, we would have had a dialogue. Unfortunately, it was never brought to their attention. I think they were about 3 or 4 years old, but if it was brought to their attention, I believe there would have been a dialogue. So again, the journey, you've got to be ready. You've got to eliminate those symptoms. Medication does help. Lowest dosage, in my case, at this time, a good dialogue with your doctor, have a good treatment team, family support, financial stability, structure, all those will get you a long ways on your journey.
Thank you, Calvin. Really appreciate that. A lot of information right there. Jean, I'm going to ask you now. Where were you? What place were you at where you decided it was time to accept the resources that were out there?
Well, I would say part of the process is finding resources, because the subjects surrounding which I needed support were not things that were normal topics of conversation, at least in my circle. We certainly didn't talk about mental health in my work environment. We didn't talk about mental health in my where I worship. We didn't talk about mental health at book group very much, you know, and so I found that once I started talking about it, then I found who I could trust and who I could talk to. At the time I was diagnosed with HIV, actually, it was the time of the dentist in Florida who had intentionally infected his patients, and people who were perfectly capable of being able to continue to work professionally were being fired and whatever. And so I actually had to keep my HIV infection a secret for decades. And there was a similar stigma surrounding my husband's suicide. You know, in our congregation, they always announce births and deaths and marriages and things to celebrate. And my husband's death was never announced over the pulpit. Um, and so I eventually was able to find support groups. I was not welcome in the support groups that were mostly gay men. And eventually I was adopted by a cancer support group that was composed mostly of people who had both HIV and cancer. And so I had that experience of being accepted and learning coping skills from people who were dealing with similar issues about their mortality and quality of life and things like that are really important to have a sounding board for and to have sources of wisdom on. When I became a parent of a seriously mentally ill child, whoa, let me tell you what it's like to be a parent of an ill child. I mean, it's like blame is supposed to be something of the past, and it is not. It is alive and well. And I am so glad for the circle of people that I met during that early experience. My daughter received, and our family received, wraparound services from Edgewood, and my family partner from then is still a dear, dear friend, and we knit together. And but learning that there was a place to actually talk about it, because we need to be able to express our experience in order to start to work through it. And so once again, this comes to peer support. It's just incredibly important in getting together your strengths to be able to move forward and getting the right kind of support. And sadly, the medical model did not provide that to the extent that the peer support model did. So both are necessary, but you know, yeah, like Calvin and John, I will cheer on peer support. Thank you.
Here, I just want to say that was quite a journey for you in terms of trying to find a peer support group even. And I know you mentioned we don't talk about mental health in all of these arenas. We don't talk about grief, death and dying in all these arenas also, which impacted your life significantly. So thank you for your share. Okay, John, if you would be so kind to tell us where you were in your life when you realized it's time to accept the resources. I need the resources. Where were you, John?
Yes, the first thing I think about is Jean's story. If I had completed my first suicide, I would have left my 7-year-old daughter without a father. And so that makes me think about what happened with Jean. I just want to say one thing, that I'm grateful that there's a church I'm slightly involved with here in Menlo Park called St. Raymond's, and the Catholic Church community is beginning mental health ministries. So I'm finding, I don't think a lot of churches, except for like Menlo Church here in Menlo Park as well, are that aware of providing the spiritual needs in the form of mental health support for their congregations. And so I appreciate that some of those things, at least here in Menlo Park, are happening. I was first diagnosed when I was 26 with clinical depression in 1982, and I ended up at I had no idea what my diagnosis meant, actually, for a couple decades. I didn't understand, other than I felt bad, and you know things didn't make sense. That was kind of the where it was at, and I ended up at a Christian counselor at the time, which had its pluses and minuses. Um, and one of the unfortunate things about the BHRS community today, or at least the clinics, is that most clients feel this way. That I believe it's something like 80% of the clients wish they could discuss their spiritual needs with their providers, but yet only 20% have ever had any kind of spiritual conversation. Of course, those things can't be directed at, if you're a Catholic, let's talk about your Catholicism and mental health. So you can't do that. But so one of the things too about my suicide situation was that I had no idea at all that there was a suicide prevention hotline. I had no idea, no thought of it, no thought of looking it up or anything. And at the time, of course, the internet was not active. But today, fortunately, there are places like Star Vista and Heart and Soul and NAMI San Mateo that have resources for people. Okay. But overall, I just come back to, as far as programs, I come back again to peer support. I believe that we as peers today are obligated, just as I, as a spiritual person today, am obligated to help people address their heart issues in those areas. And I don't know that many of my peers understand that, but fortunately, those I know in our health equity initiatives, such as Lived Experience Education Work Group, do understand that and are committed to that. But my experience began with the suicide attempt put me into Kaiser system, and that was useless. One day I was really troubled, and I walked into a Kaiser clinic with a knife on my belt to get their attention, and said, I need some help. And I didn't touch the knife or anything, but it was obvious that it was there, and I think it worked. But Kaiser was pretty much useless, and that put me into BHRS, which in the beginning was confusing and not very helpful, to be honest, either. But this was back in 1989, and things are different today. All I have to say is that the things I found in my journey early on, I think, like Calvin sort of said, were that the opportunities for help were not there, and the idea of where to find the help did not exist. And you were in such a state of misery and pain that you had no clue as how to approach things. So peer support, again, I come back to that, is the value for me today.
Thank you so much for sharing that. It seems like that was quite a journey for you. Yeah, and I'm glad everyone is still here today so we could have this panel discussion. Our fourth question is, Jean, I'm going to ask you first. Would you be willing to share with all of us that which you know now about your recovery process and what you would say to your younger self if you had that opportunity?
I think I would reassure my younger self back then that even though the stigma was really loud, that actually there were very quiet people there that just would fall over each other to support me if they knew I needed support. And to ask, and to be able to move on if someone was not able to provide the kind of conversation and space that I needed in terms of support, that there are other people that had that capacity, and I just needed to be willing to look for it. And I think the other thing I would tell my younger self is that there were strengths there that I had no idea about, and that I would come to see them as I used them.
Yeah, there would be a lot to share with your younger self. Thank you. John, I'm going to ask you.
I think I'm next.
You're next, Calvin. Go for it then.
Are you talking about number 4?
Yeah, it's about your recovery process and what you would share with your younger self.
Yeah, I think, okay. It shall pass. The trauma shall pass. Try to stay in the moment. That means, in my case, reading something about meditation. And when you think about how you're going to do certain things, and one of the things I had to learn is anger management. I had so much anger about the injustice I thought, also the diagnosis that was given me and the terrible, terrible label that they give you and the stigma that goes with that. And you have to say to yourself, I will overcome no matter what, and I'll keep on trying until the day I die. And so you never want to give up. And of course, I had a reference that I mentioned earlier. So what would I say about my recovery with my younger self? Be patient, but up to a certain point, realizing that you've got to do your part. You've got to take that little step. Recovery is getting up in the morning, if you can, just to get out of bed. And being proactive, reading about other people's journey, preparing yourself for the day. All those sayings, life is what you make it, they mean so much. So my recovery process, younger self, you shall overcome. Reach out and get away from your comfort zone if you can.
Okay. Thank you, Calvin. It's a lot of wise advice there. John, what you've been through your recovery process, and now you have the opportunity to share that with your younger self. What would you say?
You don't have it together now, buddy, but hang in there and things will get better. There is hope. One of the things I want to mention about my suicide experience is that 3 months afterward, I came home from 2 jobs at 3 in the morning, and my wife had emptied the apartment. And then she divorced me just a short time after that. So that was difficult. That brought on a lot of rage. I called her mom at 3 in the morning and yelled at her, and I was just totally lost it. And also a lot of deep dive into alcoholism at the time, even deeper than I was. But, you know, and to that point, I would also say, you know, don't give up hope. There are people there for you. She may misunderstand. You may not know where things are at, but you will survive. Things will get better. There is hope. Have faith in humanity that there are people out there who care for you. Thank you.
Thank you. I feel a lot of love and support right now for all of you. So thank you. I'd like to start with some questions from the audience, if that's okay. The first question that I see here is, could you address how your family got support during the time you were getting support? Who would like to address that?
Well, I'll go first.
Okay.
from day one, there never was too much communication in my family. When I broke down, extreme anger, and my psychiatrist at that time let me vent out the anger to him. But when I got back to the house, you would think that there would be some kind of talk like, "Hey, how'd it go? How'd the session go?" My father was buried with the crossword puzzle in his during dinner time, no talk. My mother, anguished look on her face. What? How come? What's that? What have I done? And I'm picking this up. I'm picking up the sorrow and the frustration. And I remember one time I went out and I opened up the garage door. I swear the depression, it was like a wall. This is what I was going into. This is where I lived. So I don't know. I think the question is communication is needed. And right now there is communication with my family, but at one time there was not. It would have made all the difference if they knew the support was out there. Okay, thank you.
Thank you, Calvin. Okay, Jean, what are your thoughts? Could you unmute yourself, please? Great,
Yeah.
thank you.
So there wasn't a lot of family support available to me surrounding my husband's suicide. In fact, now 16 years later, my mother-in-law still blames me for his death. So that probably was part of the building of my family by choice that had begun with my HIV infection, and that family is alive and well. So I was able to, through time, put together a family by choice who supported my journey through grief, our journey through seeking and accepting care for my daughter's illness, and that is super important. So I wouldn't, once again, back to my younger self, I would say don't say you can't do this without family support if your biologic family isn't there able to provide it for you. Keep looking for a family of choice that have within their hearts and capacity to be there for you. So that the system itself is still, I would say, for the most part, struggling to support family members. And in a lot of cases, they're not just struggling, but they're actively seeking to keep us out of the picture. And so the role of advocacy, so that family members get support and have the degree of involvement that their loved one wants in their recovery, are really important roles that as I recover, I become more active in being able to advocate for that.
Thank you for bringing that up. We have advocates in our audience today, and it's an extremely important role in helping get the support for our families and ourselves. So thank you, Jean, for bringing that up. Here's a question. People who are isolated have health outcomes similar to people who smoke 3 packs of cigarettes a day. That was a study that was done before COVID-19. What can we do to support people to overcome loneliness and isolation and work together in the community for recovery and better quality of life?
Ellen, can I speak to the family question?
Oh, I'm sorry, John. Yes, please. I apologize.
That's all right. So I am the 3rd generation of 4 who are struggling with mental illness. My grandmother was in an institution. My mother was, I understand, manic depressive. My family in my youth had no awareness of the depth of my sensitivity and pain. And adolescence was was pretty miserable until I discovered a Christian family that supplanted my family of blood. And my 2 marriages didn't last more than 10 years put together, and those family situations were, I did not know how to be married, so it wasn't like totally my wife's. It was me too. And today, during my suicide experience in 1988, the one good thing about my family that happened was that I was taking vodka and Valium, and I was in bad shape, and I was crying uncontrollably, and I called my brother Larry, who's in Mendocino now, and just to say goodbye. And I don't remember exactly what I said. I didn't tell him I was trying to kill myself. I know that. But he got a clue, and he called the Redwood City Police, and they were at my door. And I got to say, I was treated very well by them. So I'd say my brother saved my life.
Wow.
But today, I would say my family is, to be blunt, kind of useless, very distant, unreliable, not a family that I want. And like Jean says, family of choice. Again, I just come back to our mental health community is my family in every way. And I have one good friend here in Menlo Park who I've known since '95, named Ann Delaney, who is a Catholic, a strong Catholic, and has helped me with my faith. And she has been, God, so much to me. She's been my support during the time of my being lost, patient with me when I didn't show up, patient with me when I didn't answer the door, patient with me and getting me to get out and do things. And until I found our mental health community today, I had Ann Delaney, and I'm so just grateful for our community today. Thank you.
Thank you, John. It reminds me that there is a lot of healing in relationships, especially the people who we consider our family. So thank you for sharing that. Okay, going back to that question about isolation. People who are isolated have the outcomes of the same similar health outcomes of people who smoke 3 packs of cigarettes a day. And that study was done before COVID-19. What would you say, or what can we do to support people to overcome loneliness and isolation, and also to work together in the community for recovery and better quality of life?
I'd like to.
There's a lot to that question. Who wants to start? Calvin?
Yeah, and I'll make it brief. We're slowly going out of time, but I think that there has to, in your recovery, there comes a time for everything. There came a time when I could phone up somebody because I had the presence of mind and the strength and the empowerment. So today I make calls to my friends and we talk. And I have learned that you can gain so much knowledge because you're active listening on the telephone. Okay. And the question again was, okay, loneliness. Yeah. Okay. Realize that how fortunate I am because I am not in a long-term facility. I can go out. I live by myself. I provide for myself. Other people cannot do that. So kind of look around you and find out how fortunate you are. Okay.
Thank you, Calvin. Thank you for your response. Would anybody else on the panel like to respond to that? Issues of isolation and loneliness?
I did mention that I think it's strange that my depression and lostness, isolation, helped me deal better with COVID isolation. It's kind of ironic. In my isolation, my best friends were at a really nice bar here in Menlo Park called the British Bankers Club, where I went drinking, and they were really good quality of barmaids, uh, respectful and wealthy and things like that I was not at the time. And to reach out to people today in our community, I think we need to have a program where the peer support teams of the future that are going to be certified by the state of California go out on the streets. I think we need to be going into the communities just like people that serve the homeless. And one of the things I do is I wear these things on my hat, the Suicide Prevention Month and the Mental Health Awareness Month pin. And I wear T-shirts a lot. It sounds maybe a little corny that I pretty much advertise for mental health.
Mhm.
And I have these shoes that say hope on the front end that are suicide prevention shoes. And I do that to try and provoke conversations. I do that to try to get people to ask, what does that mean? And one year, there was a button for Mental Health Awareness Month. I think it said something like start the conversation or something like that. And this guy asked me about it. He thought for some reason it was about heart disease or something like that. So it did successfully get a conversation going about mental health. So I think we need to do things like that. I think we need to be more aggressive about going out and serving our communities instead of sitting around and commissions and meetings and trainings and talking about mental health.
Ellen, I'd like to say something just for a minute.
Sure. Thank you, John.
Yeah, we do need a dialogue in this country on the status of the mental health system. We do need a dialogue, yes, but yeah, also I think mentorship. If you want to get the community involved, mentor. Come to our centers and mentor. Be with our people, help them. We need role models. That's all I want to say to the community.
And like Calvin mentions that, I think of the friendship centers that Behavioral Health and Recovery Services have. And Heart and Soul has some meetups, and NAMI does too. It's good to show up at those and do what Calvin's talking about, and interact with people and support people, learn to be mentors to people. That's good.
I also just thank you both. I just also want to add intergenerational involvement and engagement. I think that's very important also. Jean, and then we have a question from the audience, so.
So my response to the isolation thing is, you know, I think we all need to make space in our lives and our groups for others, and so that people will feel welcome to join our knitting group or our book group, or to come see about emergency preparedness, not make it such a lofty thing. What do I have to do to join? It's to have opportunities in our community to be together and to learn together and to connect with each other. I work in our community garden in Millbrae, and you know, it's been a blast getting to know all these different people that are at various places in knowing how to grow stuff, and just enjoying the experience of community. So making those kinds of things welcoming to everyone, regardless of their age or their mental health status or whatever, so that people can, you know, be a box in a Zoom room or actually eventually come in person and dig in the garden together, because those natural activities that we do are the way that we make connections with each other.
Thank you. Thank you. It's so true. We really need those spaces where we can come together. I'm going to ask this question. You've talked a lot about your recovery due to self-healing, and the panel, the audience member is asking, what were medications involved also for successful outcomes? Who would like to take that?
Yeah, just recently, I have a dialogue with my psychiatrist. We've agreed that I could stay at the lowest dosage, which I do, but I started to fool around on my own, and I made a mistake. In this isolation, I woke up one morning, I was spaced out. I knew exactly, because of my experience and lived experience all those years, I had to get out of my apartment. I had to take the right dose of medication. So I knew what to do. So I do know what happens when you're not careful with your medications. But I am fortunate enough to be at the lowest dosage, and I do know what happens when you are on medications, when you feel that you're going to go out of your mind, you're jittery, you can't stay still, and this is a God figure that you have to talk to. So always have this dialogue with your doctor, and again, you have to be ready for certain things. Hopefully you'll be ready to have a constructive dialogue.
Thank you, Calvin. Would either Jean or John, would you like to respond to the question about medication?
I've been fortunate to have good responses for years to medication, and I'm grateful that medication is there. I've had a real problem with sleep for about a year now, and my Dr. O at South County has given me some good sleep aids, and they've been helping. I don't feel anything has been addictive. I have rarely had any side effects at all, other than a little, maybe, lightheadedness or tiredness, but I'm grateful for medications.
Okay, thank you. Thank you both. We have many more questions, but unfortunately, we only have a few minutes left. And I think it's important that we get to see some of the resources. So I'm going to ask Sylvia if it would be possible for, to show some of the resources. And panel, please please let us know if there are some resources that are not included that you'd like to add?